The treatment process for a patient starts off with the first visit, and that's where we evaluate everything about their clinical condition, whether it's other diseases that they may have that may affect in a positive or negative manner, the application of the stem cells. It takes into effect what their nutrition is. It takes into effect their vitamin status. There are certain supplements that are beneficial that will start nutrition-wise, whether they're in congestive heart failure, they have a lot of fluid built up, so we will optimize them. Once we have them optimized, and I've reviewed all their data, including catheterizations or nuclear studies, I determine what is the best method of delivering the stem cells to the heart, because there's two methods available. One is into the coronary arteries via catheter, and the other is a direct injection into the heart tissue itself. And it depends on the area of damage, whether that damage has good blood vessels going to it that we can use the blood vessels or not. So all this is taken into consideration. Once I've made the recommendation as to which of the two processes the patient is eligible for, all those records then are transferred to the treating facility. So it either all goes to the center of the Bahamas or it goes to Bangkok, where they make the arrangements to accept the patient. Once that's been done and we have a date, we need to make sure the doctors are available, the facility is available, the slot is open, that it's not full with patients. We set a blood draw date where the blood is drawn here, it's packaged, and then shipped to our cell processing center in Israel. Israel has probably the world leading area in stem cell research and development, and that's where this process was developed to begin with. So the cells are then processed and expanded. They're grown into many, many, many millions of stem cells, and it takes about 5 days to do that. In the meantime, the patient has already gotten on a plane and gone to the center and arrives there at the same time that the stem cells arrive. The stem cells then are delivered either via catheter or via injection into the heart. The patient is monitored overnight if it's the catheter, then he's discharged the next day and followed up prior to flying home. If he's in Bangkok, we wait several days afterwards to make sure he's ready for the long flight back. With the Bahamas, because it's such a short flight, 1 to 2 days is adequate. If he has the open surgical, or she has the open surgical procedure, then it's several days in the hospital and then several days in that country and then back, and that's Bangkok. In the Bahamas, we'll be doing that same procedure from inside the heart with a new catheter that's been developed